Now let's see what abortion does to this, our second patient. We have then the 12-week unborn child in the uterus being this muscle surrounding the child. When the abortionist commences the procedure, he will first place this instrument, which is known as a speculum, into the woman's vagina, and will then open it in order to visualize the cervix, the neck of the womb, here. Having visualized the cervix, the abortionist then takes this instrument, which is known as a tenaculum, and fastens it securely through the speculum onto the cervix in this manner, clamping shut the tenaculum and getting a firm grasp on the cervix. The next instrument which is brought into play is called the sound. This instrument is then introduced into the uterus, and it is then removed, the abortionist having ascertained exactly how deep and in fact how large the uterus is. And then this set of dilators, these metallic curved instruments, are used to effect the opening of the cervix in order to introduce, finally, the abortion instruments themselves. The abortionist first introduces the most slender of these instruments into the cervix to dilate the cervix, turns the instrument around to a slightly larger end, introduces that end, and then works his way through the various graduated, increasingly larger ends of this dilating instrument. He will then take the instrument known as the suction apparatus, which is opened. It is in a sterile container prior to the actual use of the instrument, and then this will be inserted through the dilated cervix up into the uterus and will then puncture the sac surrounding the child, allowing the amniotic fluid to escape. The instrument then will come into direct contact with the child, and with a pressure of approximately 55 or so millimeters of mercury applied to the end of this instrument, as it is attached to a long, thick suction tubing at this end and to the abortion instrumentation, that is the machine, at the other end. The suction tip will begin to tear the child apart. The pieces of the body are torn away, one by one, until finally all that remains are shards of the body and the head itself. The head will be too large to come through this instrument itself. This will necessitate the introduction of this instrument, called a polyp forceps, into the uterus through the already dilated cervix, and the abortionist will then attempt to grasp the free-floating head of the child in the uterus between the rings of this instrument. The head is then crushed, the contents of the head removed, and finally the bones of the head. And the abortion is then effectively at an end. Now, for the first time, we're going to see a film made with real-time ultrasound imaging of a 12-week abortion. Bear in mind that this is not an unusual instance, a late abortion. This is one of the 4,000 or so a day done every day in the United States. Now, let's turn to the actual film itself. We are now looking at a sector scan of a real-time ultrasound imaging of a 12-week unborn child. The child is orientated in this direction. You are looking now at the head of the child here, the body of the child here, and this image is the child's hand approaching its mouth. Looking a little more closely at the child, we can discern the eye, or the orbit of the eye, here, the nose of the child here, the mouth of the child here, And we can even look at the ventricle of the brain here. This is a fluid-filled space in the brain. We see the body of the child here with the ribs in silhouette and the spine of the child at the back. This rather granular area of tissue at the top of the sector appears to be the placenta or afterbirth of the child. And we can begin to see down here the thighs, the lower extremities of the child coming off the body in this manner. Now, let's move to the action. We now see the heart beating here in the child's chest. The heart is beating at a rate of approximately 140 a minute, and we can see the child moving rather serenely in the uterus. One can see it shifting position from time to time. It is still orientated in this manner, and the mouth is receiving the thumb of the child. The child again is moving quietly in its sanctuary. Now, this shadow which we are seeing down at the bottom of the screen is the suction tip. We have colored the suction tip deliberately in order for you to discern it more clearly. But the abortionist has now dilated the cervix and is now inserting this suction tip, which you can see moving back and forth across the screen. You will note that as the suction tip, which is now over here, moves toward the child will rear away from it and undergo much more violent, much more agitated movements. The child is now moving in a much more purposeful manner. Its orientation changes from time to time. It is rearing again here. Now, the suction tip has not actually touched the child, even though the child is extremely agitated and moving in a violent manner. The child has now moved back to the profile view, and the suction tip is flashing once again across the screen. The child's mouth is now open, and we will see that again on a freeze frame in a moment. But this suction tip, which you can see moving violently back and forth on the bottom of the screen, is the lethal instrument which will ultimately tear apart and destroy the child. It is only after the fluid has been broken, the sac has been disrupted, that the tip will actually come against the child. But we can see the tip moving back and forth as the abortionist seeks the child's body. Once again, we see the child's mouth wide open in a silent scream in this particular freeze frame. This is the silent scream of a child threatened imminently with extinction. Now, the heart rate has speeded up dramatically, and the child's movements are violent at this point. It does sense aggression in its sanctuary. It is moving away. One can see it moving to the left side of the uterus in an attempt, a pathetic attempt, to escape the inexorable instruments which the abortionist is using to extinguish its life. Now, the heart has again perceptibly speeded up. We can time this at approximately 200 beats per minute. And there is no question this child senses the most mortal danger imaginable. The membrane has now been punctured and the fluid has escaped. One no longer sees that large reservoir of fluid surrounding the child. But once the fluid has been drained off, the suction tip has now been firmly clamped to the child's body, and the child is being pulled in a downward direction by the abortionist's suction tip with the negative pressure applied to it, and the body is now being torn systematically from the head. The head of the child being in this direction here. I am now outlining the child's head. The lower extremities have already been lost, and we see the suction tip flashing from time to time in the screen as a typhoon-like series of echoes, and the child is being tugged back and forth, as the suction tip has now been applied to the body and the abortionist is exerting his traction on the child in this manner. The child's head is still discernible here. The body is no longer discernible. It has now been torn from the head. What we see now is the head itself with what is called the midline echo of the head and the spicules or fragments of bone. Now this head, which I'm outlining here, on this 12-week child is simply too large to be pulled in one piece out of the uterus. The abortionist is going to have to employ this instrument, the polyp forceps, in an attempt to grab the head. The abortionist will attempt to crush the head with this instrument in this manner and remove the head piecemeal from the uterus. We now see intermittently the shanks or blades of this instrument appearing in the image here. The head tends to float freely in the uterus. Here are the shanks or blades of the instrument coming across here. And the head is now being locked on by this polyp forceps, and the head is being pulled down toward the cervix. Now all we see remaining are simply the shards, the broken fragments, the pieces of tissue which document that there was once a living, defenseless, tiny human being here. Late abortion has become so frequent that there are actually textbooks written about it, detailing the techniques, and in addition, there are articles written on the subject. Here is an article which indicates that the author studied at least 700 women who had had third trimester abortions between the 7th and the 9th month, and states the following: dilatation and evacuation, a procedure which we will discuss in just a moment, has been proposed as the treatment of choice for women seeking abortion in the third trimester of pregnancy. D&E, dilatation and evacuation, is the procedure used to accomplish late abortion in the 2nd and 3rd trimester of the pregnancy. In this procedure, a laminarium, this device, is placed into the cervix, the neck of the womb, the night before. This is simply a piece of seaweed which swells up during the night, and in swelling up, opens up the neck of the womb so that the next morning, when the woman is brought to the operating room and put under general anesthesia, the neck of the womb, the cervix, is already partially dilated, and the cervix is further dilated with instruments of this sort. This instrument is placed up into the cervix, the neck of the womb is further dilated, and even instruments like this are used to accomplish dilatation sufficient to allow breaking of the bag of water, and then the introduction of this grasping instrument, an instrument which can locate the child in the uterus and crush and destroy it. The patient is being prepared for the procedure. The fetoscope, the fiber optic instrument through which we will observe this abortion, as it begins in a swirl of blood. The forearm. Note the blood vessels running under the delicate skin. The hand and the fingers. This thick blue coiled structure is the umbilical cord. This is the child's lifeline to the mother. This was a little boy. The ear is readily identifiable. It has been shown that in the later months of pregnancy, the child will react to sound. The nose.
Here is the mouth. This little fellow can be seen swallowing water. The eyebrows. The eyelids are still closed. These are the tools of the abortionist's trade. In a few moments, this little boy's life will be summarily extinguished with these instruments. The cervix has been sufficiently dilated, and the bag of water is broken. The umbilical cord has been severed, the lifeline cut and collapsed. Now it is being wrenched free of the child's body. And now the abortionist is reaching into the uterus with the grasping instrument to dismember the child. Piece by piece, the extremities are pulled away, then portions of the back, the spine, and the torso. A portion of the chest and abdominal wall has been torn from the body. The ribs are easily identified. Can anyone doubt this child has experienced an unimaginable agony? Pieces of the torso are being removed, and the parts are stacked on the table to the side of the abortionist in preparation for reassembling the child to assure that the abortion has been complete. In this pathetic pile of human rubble, we can discern a leg with the foot still attached. The head is located, and having been located, is grasped in the jaws of the clamp. The clamp crushes the head, and the head is then removed in pieces. The crushed head has now been removed, and the white matter of the brain has spilled out. After the procedure has been completed, this instrument, a curette, is introduced into the uterus. This curette is used to scrape out all the fragments and the shards of the afterbirth and the child which remain, and the procedure is then at an end.
Finally, I'm going to describe a third trimester induced abortion, which is performed at 25 weeks to term. At this point, the baby is almost fully developed and viable, meaning he or she could survive outside the womb if the mother were to go into labor prematurely. Because the baby is so large and developed, this procedure takes 3 or 4 days to complete. On day 1, the abortionist uses a large needle to inject a drug called digoxin. Digoxin is generally used to treat heart problems, but a high enough dosage of digoxin will cause fatal cardiac arrest. The abortionist inserts the needle with the digoxin through the woman's abdomen or through her vagina and into the baby, targeting either the head, torso, or heart. The baby will feel it. Babies at this stage feel pain. When the needle pierces the baby's body and the digoxin takes effect, the life of the baby will end. The abortionist then inserts multiple sticks of seaweed called laminaria into the woman's cervix. They will slowly open up the cervix for delivery of a stillborn baby. While the woman waits for the laminaria to dilate her cervix, she carries her dead baby inside of her for 2 to 3 days. On day 2, the abortionist replaces the laminaria and may perform a second ultrasound to ensure the baby is dead. If the child is still alive, he administers another lethal dose of digoxin. The woman then goes back to where she is staying while her cervix continues to dilate. If she goes into labor and is unable to make it to the clinic in time, she will give birth at home or in a hotel. In this case, she may be advised to deliver her baby into a bathroom toilet. The abortionist then comes to remove the baby and clean up. If she can make it to the clinic, she will do so during her severest contractions and deliver her dead son or daughter. If the baby does not come out whole, then the procedure becomes a D&E, a dilation and evacuation, and the abortionist uses clamps and forceps to dismember the baby, piece by piece. Once the placenta and all the body parts have been removed, the abortion is complete. Late-term abortions have a high risk of hemorrhage, lacerations, and uterine perforations, as well as a risk of maternal death. Future pregnancies are also at a greater risk for loss or premature delivery due to abortion-related trauma and injury to the cervix. As I mentioned at the beginning, I'm Dr. Anthony Levatino, and in the early part of my career as an OBGYN, I performed over 1,200 abortions. One day, after completing one of those abortions, I looked at the remains of a preborn child whose life I had ended, and all I could see was someone's son or daughter. I came to realize that killing a baby at any stage of pregnancy for any reason is wrong. I want you to know today, no matter where you're at or what you've done, you can change. Make a decision today to protect the preborn. Thank you for your time. I will no longer do any more abortions. When you finally figure out that killing a baby that big for money is wrong, that it doesn't take you too long to figure out it doesn't matter if the baby is this big or this big or this big or maybe even this big, it's all the same. And I haven't done any since then, and I never will.
We welcome our distinguished witnesses today. Do you and each of you swear that the testimony that you are about to give shall be the truth, the whole truth, and nothing but the truth, so help you God? And I'll now begin by introducing today's witnesses. The first witness is Dr. Anthony Levatino. Dr. Levatino is a board-certified obstetrician gynecologist. Over the course of his career, Dr. Levatino has practiced obstetrics and gynecology in both private and university settings, including as an associate professor of OBGYN at the Albany Medical College. And Dr. Levatino, we'll begin with you. Welcome.
Thank you, Chairman and members of the committee. I only have 5 minutes, so I'm going to get right to it. Second trimester D&E abortions performed between roughly 14 and 24 weeks of gestation. Your patient today is 17 years old. She's 22 weeks pregnant. Her baby is the length of your hand plus a couple of inches. And she's been feeling her baby kick for the last several weeks. She's asleep on an operating room table. You walk into that operating room scrubbed and gowned, and after removing laminaria, you introduce a suction catheter into the uterus. This is a 14 French suction catheter. If she were 12 weeks pregnant or less, basically the width of your hand or smaller, you could basically do the entire procedure with this. But babies this big don't fit through catheters this size. After suctioning the amniotic fluid out from around the baby, you introduce an instrument called a Sofer clamp. It's about 13 inches long. It's made of stainless steel. The business end of this clamp is about 2.5 inches long and 1/2 inch wide. There are rows of sharp teeth. This is a grasping instrument. When it gets a hold of something, it does not let go. A D&E procedure is a blind abortion, so picture yourself introducing this and grabbing anything you can blindly and pull, and I do mean hard, and out pops a leg about that big, which you put down on the table next to you. Reach in again, and pull out an arm about the same length, which you put down on the table next to you. And use this instrument again and again to tear out the spine, the intestines, the heart, and lungs. Head on the baby that size is about the size of a large plum. You can't see it, but you pretty good idea you've got it if you've got your instrument around something and your fingers are spread about as far as they go. You know you did it right if you crush down on the instrument and white material runs out of the cervix. That was the baby's brains. Then you could pull out skull pieces. And you have a day like I had a lot of times. Sometimes a little face comes back and stares back at you. Congratulations, you just successfully performed a second trimester D&E abortion. You just affirmed her right to choose.
You are not alone. There are loving alternatives to abortion. On your screen, you'll see organizations ready to support you with care and compassion. In the description section, you'll find these resources also. There are people who want to help you. Reach out to them.